Hello, I'm Dr. Fred Tenover, Vice President for Scientific Affairs at Cepheid. Today I'd like to talk to you about a very important issue, that is carbapenem resistance, which is both a medical and a public health challenge. Carbapenem antibiotics are often called the drugs of last resort, and they're often reserved for very serious and life-threatening infections. The carbapenems are in a class of antibiotics called beta-lactams, and you can see the beta-lactam ring shown in each of these four structures. Indeed, the carbapenems are very similar to penicillins, cephalosporins, and monobactams like aztreonam, but they have more complex structures. It's important to realize that carbapenem-resistant bacteria are usually resistant to almost all antibiotics, which makes these infections very difficult to treat. In 2013, the CDC issued their antibiotic resistant threat report, and indeed Carbapenem-Resistant Enterobacteriaceae, or CRE, were listed as urgent threats, even more important threats than MRSA and multidrug resistant tuberculosis. Data from 2012 showed us that about 4% of all U.S. hospitals had patients that had infections with CRE, and about 18% of long-term care facilities had patients with such infections. In fact, in 2012, 42 states had seen such an infection. What's most important, though, is that these are very serious infections. In fact, 1 of every 2 patients that developed a bloodstream infection with a carbapenem-resistant Enterobacteriaceae went on to die. Now, you may ask, what are the rates in 2015? Well, we really don't know because these are not reportable infections and there is no active surveillance. We do have a sense, however, that virtually all 50 states have now recognized these types of infections. But this is not just a hospital issue. This article from the Los Angeles Times shows us that even nursing homes in the Los Angeles area can have problems with these types of organisms. In fact, over 300 KPC-producing Klebsiella pneumonia infections, that is, highly drug resistant, were seen in Los Angeles nursing homes. Thus, long-term care facilities provide an important reservoir for MDROs that can serve as a source of infection in hospitals. Even endoscopes, which are commonly used in procedures, can be contaminated with Carbapenem-resistant Enterobacteriaceae, and this has led to a number of problems in hospitals across the United States. These organisms are often referred to, in fact, as superbugs because they are so difficult to treat. Carbapenem resistance is a global problem, as you can see in this slide. The countries shown in red have large problems with Carbapenemase-producing organisms, while those in green have other problems caused by other resistance genes. In Europe, we can see that the problem is not the cause of a single organism or a single resistance gene. We sometimes talk about KPC, or Klebsiella pneumonia carbapenemase, but that's just one of several major families of carbapenem resistance genes that also includes the VIMs, the Verona integron-mediated enzymes, the NDMs, the New Delhi metallo-beta-lactamase, and the oxacylinase 48 or OXA48 enzymes. All in all, if you tally up all the carbapenem resistance genes that have been seen globally, they now number more than 100, and they are very transmissible from species to species. Now, we've talked about the acronym CRE, Carbapenemase or Carbapenem-Resistant Enterobacteriaceae, and this refers to common organisms like Klebsiella, E. coli, and Enterobacter. But there are other organisms that can become carbapenem resistant, including hospital-acquired pathogens like Pseudomonas and Acinetobacter. So we sometimes use the acronym CRO to cover this broader group of organisms. However, one very important mechanism of resistance are those organisms that contain a carbapenemase, that is, an enzyme capable of breaking down a carbapenem antibiotic. This subgroup we often refer to as CPE, Carbapenemase-Producing Enterobacteriaceae, or CPO, to include the larger group of carbapenemase producers, such as Pseudomonas and Acinetobacter. It's important to realize that carbapenemase producers, or CPE, are just a subset of the larger category of carbapenem-resistant ones, but in fact they're the most important ones because these are the ones that are most likely to spread in hospital and cause a rapid rise of resistance. So the CPE are the focus of many infection prevention programs, indeed because they are most likely to spread high-level resistance. The CDC has listed several different things that hospitals need to consider to confront the problem of CRE. And most importantly is that each laboratory in a hospital should be able to identify CRE organisms that are present. You need to know the rates of CRE in your hospital, but the CDC says you also need to know the rates of hospitals around you because we have seen patients move from facility to facility. So understanding the prevalence in your hospital and your city or even your region can be very important for building your prevention programs. And the more information that you have about which types of CRE, specifically CPE, are in your hospital, the better your infection prevention programs are going to be. So let's summarize. Carbapenems are the antibiotics used to treat serious life-threatening infections when other antibiotics fail. Carbapenem resistance is spreading globally in multiple species of bacteria. There are multiple mechanisms of resistance that have been described, so this makes this an urgent public health problem. Laboratories must be able to identify and differentiate the more worrisome category of carbapenemase-producing organisms from the broader category of just carbapenem-resistant organisms to optimize infection control and infection prevention efforts. Rapid identification of CPE in the laboratory and through active surveillance of patients on the wards is the key focus of CDC recommendations to control the spread of CRE in U.S. hospitals. Thank you very much.